Today we will have a practical life, guys. Alright, we'll give it just a minute. I hope you can hear me well. Let me know. I'm sorry there will be some background noise because of the geographical position of the place where I work. It's next to the main road. But I hope the sound is good. I hope the mic works and you receive some valuable information today. Alright, so it's 1:15 and I think we can start. I know it's lunchtime as always, so you might watch this video in recording. Fingers crossed it's safe. So today, guys, I would like you to show actually practical tips what you can do for about your cesarean section scar from day 0 to 6 weeks. Before I get there, I would like to talk about very briefly why we will need cesarean section scar massage. In the beginning, I wanted this video to... You sound loud and clear. Okay, I will try not to shout more than that. Thank you. So, in the beginning, I wanted to do it more like a talking head explanation live, but then I thought, you know, what's the point me blabbing there, because I can put this information also in some stories and you can read it. But the practical bit is important. So, everything started when I recently read a message in one of the many moms Facebook groups I'm in, and one of the mother complains that she's still, after something 9-10 months after giving birth by a C-section, she still has some pain around the scar. She feels like she can't move properly, and if this is normal. And guys, everyone, every single one in that thread, the moms who were answering were saying that it's normal. Yes, it's normal. This is how it is. I'm experiencing same thing. I had 1, 2, 3 cesarean section. I had my cesarean section many years ago. I had my... Every single person, every single one in that thread, and there were not 2, 3 people, it's large group, said it's normal. And here went me, and I was trying to do my breath, and I explained why cesarean section pain is not normal, and there are things you can do about it. And I'm not blaming the moms, you know, giving any wrong advice, because we know what we know. We experience what we experience, and we don't know any better if we don't know. So my work here is to educate and hopefully promote the fact that no, pain after major abdominal operation can be addressed, even long-term pain. So 2 main things. Very briefly, why do we want to do cesarean section scar massage is, and rehabilitation subsequent through the movement and exercises. Number 1, pain. We don't want to live in pain. Okay? Nobody wants to live in pain. Pain on movement, pain on intimacy. And second of all is function that is very closely connected to the pain. We don't want to sit and feel like something is pulling us. We don't want to feel like we cannot engage our abdominals every time we want to do an exercise. We don't want to feel like we are leaning forward all the time. So whenever you have abdominal operation, cesarean section in this particular instance, but also any abdominal operation, is as a protective reaction, we do slouch forward. We kind of try to reduce tension around the abdominal area. We try to protect it. We don't want to engage anything, and we stay there, and this is how our brain learns. It learns that this is our normal, and it's not. And we start to function from this non-optimal position. We start to exercise from this non-optimal position. We start to walk from this non-optimal position, and it goes on and on and on for years, for decades. All right? So if we massage our cesarean section scar, we allow those tissues to open, to relax, to stretch. We allow our brain and body connection that will tell us this is safe, this is okay, this area is functional, it can move. Subsequently, we break down any adhesions that might have formed during the healing process. We also help again the mobility of the fascia. Fascia is the layer of connective tissue that runs in between the muscles, and that is actually not as stretchy and elastic as muscles are. And if there is a cut through the fascia and then subsequent stitch, it can become kind of a sticky, like a bit of a glued area. Okay, so let me just quick remind you why it's important to do the scar, including indirect scar massage from 0 to 6 weeks that we are going to do today in a bit. So just a quick reminder how the C-section is performed. So you get your cut. I already draw here a black line that will represent the external cut that you all can see after cesarean section, but also the cut is done along the abdominal muscles. And this is a good thing because your line that separates the abdominal, it runs vertically. All right, so the doctors, they don't want to cut along the muscles. It's easier to cut that fascia and then let it heal. It's very logical and it's okay. Then it's opened, then there is a cut on the uterus again, horizontal, baby is born, and then everything is stitched back on. And when the stitching is happening, layer by layer, these stitches kind of interact with each other. They get glued up, shall we say, with each other. So it's not like every single separate layer will move nicely and stitch separately. They're stitched together. First your uterus, then the rest of the tissue, and then the skin. Right? So you get those several stitch areas that when they heal, they might form adhesions, they might not. Sometimes it really depends on your physiology and anatomy. This is why we want to work with that area. We want to make it mobile. We want to make it move, and not only directly on our scar, but also everything above and everything below. I will not dive in about pelvic floor rehabilitation post C-section because it is a must, but we are not on that topic right now. But everything above and below the scar counts. Okay, so I think I've said a bit of theory, and let's start our practical. If you later on have any questions, you can write them down. You can write them now if you watch this live. If you watch this in recording, feel free to ask them or send me a DM. First of all, why 0 to 6 weeks? Because this is the time, 0 from day 1 to 6 weeks, where approximately you need for tissues to heal and be strong enough not to break. All right? So it's about the famous 40 days. Is for that reason. It takes time to heal about 6 weeks physiologically. Sometimes a little bit less, somebody a little bit more. Yes, I would have patients with whom we can start already some direct massage around the scar, very gentle, but it will be only under my supervision if I see that person, if I feel that person, and we can start things doing together. When I give information out online, we always stick to the safe top border, which is about 6 weeks. This is considering you didn't have any complications, you didn't have any infections, you didn't have any scar reopenings, anything like that. This is just scar that healed. Now, what shall we do? Shall we wait for 6 weeks and be in pain? And okay, it's normal to be in pain. Pain is part of the process. It might be there, it might be not, it might be less, might be more. I would say if you need really pain relief for a better function, discuss this with your doctor and take it if this is appropriate for your case. But you already can start to do a few things so that you're 2 steps ahead when you are past those 6 weeks, and you can start to do more direct things around the scar. So it stretches out, it gains, not stretches out is not the right word, it gains mobility, and the tissues around it gains optimal function. Because in ideal case, we look at the scar mobility exactly the same as the tissues surrounding the scar. So in the beginning, the scar will move less, it will be not that mobile. If you try to lift it, one part might not go up, the other might stay down, but eventually we're looking for a normal mobility, same as the tissue surrounded from the outside, which is more like skin, yes, superficial tissues, and also from the inside, deeper in. Number 1, you can do this literally from the day you come out from surgery if you feel like it. Next day, the other day, is a simple, nice, deep breathing. And I would say here abdominal breathing. And I don't want to confuse you really, guys, but I would really try to take nice deep breath into your sides here in the bottom of your lungs and letting your belly go. All right, so if you take nice deep breath in here, relaxing your belly. My scar is already stretched just by this movement, and as you breathe out, just the breath out motion. You don't need to do any contractions. No, we're not doing that. We're just simply adding a little extra deeper breath to that physiological breath and letting our belly relax. So breathe in, letting it drop, and as we breathe out, it moves back in. So just this gentle movement will start scar massage, and this is massage movement with the help of your natural breath. You can do this in the beginning just 2-3 times, up to the way you feel. If you are in a lot of pain, of course you can skip it and try just to breathe into your sides, maybe, again discussing pain relief. And then this is your exercise and massage technique number 1, abdominal breathing. And I made reel about it recently, and it's really great. When you feel comfortable enough, you can repeat it about 8 repetitions, even 2-3 times a day, so that you learn that area to move. Quite often we are so scared that something will happen, so scared that the stitches will split, that we're just there, tightening up, not moving left, not moving right. We do need to take care of our stitches, but such a gentle physiological movement will not endanger your stitches. Okay? And hopefully by that time you will do things to prevent any constipation. You'll take your stool softeners as needed, light, easy to digest food that will not give you any constipation, and so on, so you can go to the toilet easy, and there is no major abdominal pressure as well. So that's your exercise number 1. Number 2, what you can do, and this is not really an exercise, but I really, really advise you to do it. Whenever the bandage, okay, the stitches will be covered with the bandage, is coming off, okay, what you can do is you obviously will go to the shower, okay, and doctor gives his okay. Just a second. Pardoname, I'm here on the phone and people are calling me. Doctor gives you, okay, you can take off the bandage now, you can take your showers. We want to start to desensitize the scar, okay? Scar will be very, very sensitive. And this part has 2 components. One component is purely physiological, physical, okay? You might feel it numb, you might feel it a bit painful, itchy, different sensation. And the second component is the emotional. Not for everyone, a cesarean section will be the experience they dreamed of, they imagined, or the way, ended up to be. And I understand if woman tells me, I don't want to touch it, either purely for the reasons because it's scar and she doesn't feel like, this medical part thing, she doesn't like it, or because the emotional part was so difficult during the birth, she just doesn't feel like touching it. You don't have to. I'm giving you this option and you can decide. We can speak later on about the emotional part and healing part, And I can give you some tips and advice as a physiotherapist because I'm not a psychologist. But yeah. So whenever you go, let's say, to the shower, okay, what you can do, you can already start to use a little bit more textured towel and just tap the scar, okay, just with a towel. You don't even have directly to touch it with your finger. You can gently rub the towel on the scar, okay, up and down, all the directions. All right, so this is already will desensitize those little nerve endings that have been cut through the process. It's normal, and it will also, again, give your nervous system this message and your brain this message that the area is fine, it's healing, it's safe. Sometimes some women might try to do it with, for example, a cotton pad. Maybe they have a makeup brush and do it with a makeup brush. So if this area is so sensitive and you don't feel like touching it with your hand for time being, use a mediator. So it can be a makeup brush, it can be towel, it can be a cotton bud, anything like that. And this will also contribute to your rehab program for your cesarean section scar. How long to do it? Really, you don't need more than 5, 6, 7 minutes a day. All right? So it's better to do it shorter periods, but to have it a consistent habit than go and rub around your scar for 10 minutes just because you forgot to do it for the last 5 days. Small rituals that will include the scar massage. So after the shower, give it an extra minute to feel how this textured towel feels on the scar. Okay, so desensitization. We talked about breathing, we talked about desensitization. Another 2 great massage techniques, indirect, that I use, I will show you now. So indirect is we are not going directly on the scar. We are letting it heal. We are week 0 to 6 right now, okay? I will probably need to move a little bit here my camera and drop. You will not see my whole body, but it's not necessary. As soon as you feel my torso, it's fine. Now, one is amazing one is diaphragm massage. Diaphragm massage is great because the poor thing was being squeezed there by the baby and stuck in a stretched out position because of the growing baby. So it's great to give yourself a nice abdominal massage. Fascia of the abs is run towards your ribs, and also you will start to be more accustomed to be around your abdominal area. So how you do the diaphragm massage, you can do it 1 hand at a time or 2 hands at a time. 1 hand at a time. You find your xiphoid process here, the area where the ribs flare. Okay? Rounded fingers. You gently hook under and almost try to lift your ribs. And what you're going to do is to take a nice deep breath into your sides. You will feel how the diaphragm is expanding. You keep that pressure without moving your hand. And then you breathe out. There is no contraction, no engagement, nothing. Just a breath. You do it again. Keep that pressure. We're not letting it go. Breathe out. And then you can move on to the next segment. You can do it with 2 hands at a time. Breathe in. You might feel that some areas are a bit stiff. You can give it a bit of a round little massage movements. Breathe out. Okay. You stay on each segment for about 3 breaths. And you go all the way to almost to the sides of your ribs here. After that, you will get your side abdominals, and it's quite difficult to get under your ribs. So this front section of your diaphragm. On a side note, I would like to mention that first of all, it's a great movement to calm down your nervous system, to stimulate the vagus nerve, just to focus on you, just to focus on your body, okay? And it has a safe distance from the cesarean scar, but still you get this influence of the abdominal fascia. It still helps the movement at this very early stage, and it's not endangering the scar in any way. So this is your technique number 1, 2, 3. This is like a second massage technique, 3 technique all in all. And one more, which I find also great. Side note here, diaphragm massage is better done without any oils or creams. All right, it's better if you have a good grip, so skin doesn't slide. Now, with the last one, we're going to do a belly massage, indirect belly massage. To be at a safe distance, I always say 4 fingers away from your C-section scar. Now, my C-section scar could be a bit too high than an average C-section scar because it's drawn on. Yours might be a bit lower, but it doesn't matter. 4 fingers away from a cesarean scar to be on the safe side, okay? And here, we just gently roll from one side to another our belly. So we start with the palm of our hand. We push. I will show you from this side so you can see. We push and let it go back. Gently push, let it go back. Even if you come somewhere closer to the scar, you won't be able to go directly because it still will feel sensitive anyway. So I would say around belly button is the lowest you will go. Push, let it go. Push, let it go. You will see how much tension there is in abdominals. The poor thing's been overstretched during the pregnancy. If you did go through contractions and maybe you ended up with the emergency cesarean section scar, these muscles are quite tight because they've been contracting, okay? You might find some sensitive spots, trigger points. So you push and let it go. Push, let it go. Very gentle rolling and back and back. Again, getting yourself used to being in that area. Okay, being in that area. And it's also great for peristalsis, great for digestion. Up and down. I'm going here almost up to my stomach, of my ribs. Okay, forward and back. Forward and back. You can do it first thing in the morning when you're laying down, if baby's not crying, or maybe you want to do it before you go to sleep. It's very gentle, soothing movement. Okay, as you progress, as you get closer to your 6 weeks and you're getting past your 6 weeks, this technique, you will be able to go lower and directly on the scar, and you will be able to get more grip. But before 6 weeks, we stick away from the scar. We push and pull, push and pull. Okay? Now, you can do this in sitting as well. However, right in the beginning, for at least 3 weeks for sure, I would suggest you to lay down, because you're going to be more relaxed, you will be able to focus more. Closer to the 6 weeks, when you're getting slowly into your past 6 weeks, if you can go on a 4-point kneeling and do your long, nice, deep breath and let your belly drop, and you will feel the stretch here, and then you breathe out. And as you breathe out, the belly will naturally draw in. But again, this we're talking about the second half of the 6 weeks, if you feel comfortable to getting on the 4-point kneeling. Everything must be done within comfort, guys. Okay, nothing should be discomfort. Okay, we expect a bit of discomfort when we maybe move around, and we're talking discomfort not from the scar, but discomfort from the movement. Especially if you were not massaging your belly a lot, maybe you've been putting some oil during pregnancy or so on. So let's summarize: abdominal breathing, desensitizing the scar, diaphragm massage, and gentle side to side abdominal massage. This is plenty for you, plenty for the first 6 weeks, because right now your job is to recover, you take care of your baby, take care of yourself. Another thing that you can do, and I count it as an exercise, all right? After the C-section, whenever you feel like you're slouching, okay, you're kind of slouching, getting yourself straight, okay, and relaxing again, and straight, and relaxing again, that counts as an exercise. 0 to 6 weeks, getting yourself in a taller posture, and again, it will not split your scar open, okay? Scar does have certain elasticity, believe me, so getting in a straight posture and relaxing, or maybe getting in a straight posture and standing, contributes as an exercise from 0 to 6 weeks for sure. There is no need to do any major extras. The healing is most important. After that, you will introduce the things and you will be able to move with a greater speed. If you guys would like to see things you can do 6 weeks and beyond, if you would like to help yourself to go through the whole process of a C-section rehabilitation, I have designed a course with 17 videos, okay, of exercises and massage techniques. It has a timetable, what exactly to do every day, on what day, during what weeks. The cost is less than a single consultation with me, and it will take you through all the way 12 weeks and then beyond 12 weeks. And then you can go into your post-pregnancy rehabilitation as well. So you can check the link, it's in my profile bio. I think that's it for now. If you know you will have cesarean section, make sure you save this. Or if you maybe know a friend who just had one recently, they're not yet beyond 6 weeks, or they're just about approaching 6 weeks, feel free to share it, and this will help them just a great deal, just to relieve that pain, and also, most important, relieve the fear of movement, because the fear of movement is something that happens quite often post-cesarean section. Right, thank you so much for watching. I hope this live got saved, and I'll keep it on my profile. If you have more questions, feel free to DM me, to write them under the live, and have all lovely afternoon. Thank you guys. Bye bye.